Hello and welcome to my channel. So this video today is going to be about acupressure for treating neck pain as you've requested. So I'm just going to start off by showing you one of my favorite points for neck pain, and what I thought is, as you work these points on yourself, if that's your issue today, then as we go along you can listen to me just talk about what are some of the causes of neck pain and what are some of the factors that are going to speed up the healing. Let's start here looking at this picture of the ear. And so where we're going to find this point is on this bony ridge of cartilage, which is called the antehelix. And this whole antehelix is a mirror for the spine. And so it helps to understand when we're looking at auricular acupuncture to understand that the ear is a microcosm for the entire body. So we can find points to treat the entire body on the ear. So I don't know about you, I think that's quite amazing. I use the ear a lot in my clinic for all sorts of things. And so it's interesting historically to understand some of where this is coming from. Acupuncture has been practiced in the Western world, in Europe, in France, since the 1600s. It was the French Jesuits that had come back from Asia with knowledge of acupuncture. And in 1671, the French Jesuit Father Placide Harbeux published Les Secrets de la Médecine des Chinois, The Secrets of Chinese Medicine. And at the same time as this was going on, in France, they were treating sciatica by doing a cauterization technique on the ear. So they were already using auricular therapy. So was this a coincidence to the timing of the writing of this book? I'll let you decide. And then later in the 20th century, a French physician, Paul Nogier, began to develop auricular acupuncture in a system that is still being used today. Okay, so up here at the top of this map, we have the head and the neck. So people with neck pain often have soreness right here when pressure is applied. Generally, the soreness is going to be on the same side as the neck pain. So if you've got right neck pain, you're going to your right ear. So while we're working on this neck pain point, let's talk about why you have neck pain. Now, it could be something as simple as sleeping on a different pillow, different mattress. Often this happens if we bought a new pillow or mattress, or we're staying somewhere else, we're traveling. And so if this is you right now, if you woke up with a bad neck and you're at a hotel, what I recommend is that you take those hotel pillows, which are ginormous, you pull the pillow out of the pillowcase, you go to the bathroom and you get those nice bathroom towels and you're going to fold them up in a way that is just going to be the height that you want your neck to be at. So generally just a few inches is all you need. And so you can really play with this, fold it around and get it just to your liking. And I think you're going to have a much better sleep. So another main cause of neck pain is stress. So if you're going through a really stressful time and suddenly your neck seizes up kind of out of nowhere, then think about blaming it on the stress. People carry a lot of stress in the shoulders. Shoulder pain can refer up to the neck, up to the head. I know I was going through this a few months back when I was looking after my mother in hospital, and it was a very stressful time. And my right side of my neck just seized up really badly, and just out of nowhere. And so one of the things that I did to treat that was I used a point on the ankle, which I'm going to show you right now. Looking at this picture here, this is an area on the bladder channel. It's called bladder 60. It's a whole area, 60, 61, 62. You know, I put about 5 needles in this area. It worked really well. So for you, you know, you're going to just use your fingers. So this whole area you can use and just press right in, look for those tender spots. Okay, so you're just going to keep pressing on those points. Now, UB60, UB61 is for pain at the back of the neck in this area right here, the bladder channel of the neck. Now, in some cases, if your neck pain is lateral neck, this point here, bladder 62, is the point that opens the Yang Chao vessel, the Yang Chao meridian, as you can see from this picture. So if this is where your neck pain is, bladder 62, which is about a thumb width below the outer ankle bone here, is going to be your point. Now, I find, just from my own experience, that working the points closer to the bone, pressing up into the bone along this ankle point, bladder 60, bladder 61, I find I get more success, more relief doing this. Now, if the neck pain is going up into the back of the head on the ridge of the occipital bone, you can use this point here and go more into the edge of this calcaneus bone. Okay, so it's like the edge of the calcaneus bone is mirroring the edge of the occipital bone. All right, so if we're treating a bony area, we want to do the acupressure on a similar bony area for best results. Okay, so just giving it enough pressure that it's a little uncomfortable at the ankle, but you're going to find that as you continue to work it, your neck pain should start to gradually ease up. Okay, so that can look like 2 things. Either the area of the pain is going to start to get smaller and smaller, okay, so like shrinking as it fades out, or it's going to become more diffuse. It's going to spread out, but diffusing, okay, so lightening up as it fades out. So if either of those are what you're experiencing, that's a great thing. If it's not happening yet, just keep going. And then what you should start to find is you're working the ankle bone, and you're feeling, as you're working the ankle, it's feeling more painful at the ankle than it is at the neck. Okay, that's a good sign. Another cause of neck pain is injury. Common one, motor vehicle accident injury, whiplash. I've seen many of these cases. These injuries tend to be more chronic. Okay, so we're dealing with injuries often to the bone, okay, the cervical spine, which is a deeper layer of tissue than the muscle. So then you may be wondering, how long will it take to clean up this neck pain? So to answer this question, we're going to look at 3 things. The first is, how long have you had it? If it's been a long time, years or decades, then it's going to take longer. But each person has unique factors going on that are all influencing the healing process, such as inflammation, diet, poor sleep, etc., etc. But in general, if you've only had the neck pain for a few days, a few weeks, a month, generally we're going to see the results much quicker. The second thing is, how severe is the pain? If the pain is very intense, it might take more work to release that. If the pain is constant, this is more challenging than pain that is coming and going, right? If it's only there some of the time, then your body is able to deal with it on some level. So we're just going to help it deal with it better by using the acupressure. So as the neck pain starts to clear, you'll start to see that the neck pain isn't there all the time. That the duration of the pain, when the pain comes, it's lasting shorter and shorter amounts of time. Okay, so that's another way to judge the pain, how severe and what is the duration, okay, and how frequently is it coming back So intensity, duration, frequency, 3 ways of judging the level of pain. Okay, so let's look at another treatment area. If the pain is running through this back side of the neck, this is the gallbladder channel, as you can see in the picture here. If this is where your pain is, we're going to be looking at a point on the triple warmer channel on the opposite hand. So this point here is called triple warmer 3, and it's just below the knuckle between the 4th and 5th metacarpal bones. If you have pain on both sides of the neck, you're going to use both hands. Same point, both hands. If the neck pain is more at the edge of the occipital bone, then you're going to move your finger, you're going to do your acupressure a little bit closer to the knuckle bone. You're going to go right into the knuckle bone. Okay, if it's coming down the shoulders more, you'll find that as you do these treatments, that your pain will start to move around, and then you have to start chasing after the pain. So you're going to get used to paying attention to where the pain is moving. When the pain starts moving, get excited. That's great. Right? If we can get the pain to move, we can get the pain to move out of the body. So if the pain is moving down towards the shoulders, you're going to go further down the metacarpal bones, closer to the wrist. Okay, so the third issue with dealing with neck pain is to clear up any aggravating factors that might be hindering the healing process. So 2 that I want to mention are poor sleep and inflammatory diet. So with poor sleep, there's either insomnia, trouble falling asleep, or just a very restless, fitful sleep, where you wake up tired and unrefreshed the next morning. Sleep is important because it's the main time when our body does its repair work. Okay, so all of the acupressure, all of the acupuncture, all of the great food, all of these healing tools that we're using, we're setting up the conditions for the body to do the rest of the job on its own. And it does that mainly during sleep. Okay, so if you're having trouble with sleep, then, you can go to my video on insomnia and you can watch that. Or, you can come into the clinic and we'll treat the sleep issue. Almost every patient, I do a little bit of sleeping points just to help make sure that the sleep is there for the repair work to get done. Okay, so another great point for the lateral neck here on the gallbladder channel, or further to the side if you have this area of pain here on the small intestine channel. For either, we can also use this point here called Heart 7. So this is right at the wrist. It's very accessible, and you can see from this picture here where we're finding this point. So it's just under the wrist crease and just to the inside of the main tendon. So you can just apply some pressure here. You can also move down the wrist a little bit towards the elbow. If you find that the neck pain is also moving down into the shoulder area, you're going to move downwards for that. And so you can work all of these acupressure points, you can work them for, 3, 4, 5 minutes at a time. I usually go, right side, left side, I'll do 5 minutes on one side, switch to the other side, if that is correct for that meridian. Not all the meridians work opposite or same side. You just have to follow my instructions. So if your pain is here on the gallbladder channel, you can use either left or right, Heart 7. If your pain is more along this small intestine channel, you want to do opposite side, Heart 7. So you can work these points several times a day. And what you can also do is you can use acupressure seed stickers. And what's great about these stickers is it just helps you remember where to find your point so that you don't have to come back and, watch the video all over again. You can just put the sticker on and then it's there all day. Sometimes the stickers will stay on for a whole week, I've seen. So, you'll get some good traction with that. And it's a good reminder too, when you just see the stickers there, it reminds you to do your acupressure homework. On the ankle, it's called gallbladder 40. This is going to treat pain along the gallbladder channel, just the same as what we were looking at. So this is quite a large area. Some people have this area of the foot a little bit puffy, a little bit swollen. So just your finger in there until you're probably going to find 2 or 3 tight spots if you dig into it. It's quite a large area. So give it some good firm pressure. You can really dig into this spot. And, just know that when we are stimulating the acupressure points, what we're doing is we're causing the body to make its own medicine. Okay, the body can make its own medicine. This is one of the core principles of acupuncture, acupressure. So it's very affirming to hear that about our body, isn't it? Okay, so that should get you started with some pain relief for your neck. If you're finding that your neck pain isn't clearing up as much as you'd like or as fast as you'd like, you may need to consult your local acupuncturist to support you more through this healing process. So acupuncture is a more stronger and efficient treatment because we're able to treat several points at the same time. Okay, so thanks again for joining me here, and I look forward to connecting with you in the next video.